Hey, Kallie, how are you?
Wow.
It's so good to see you again.
It's been a long summer, so apologies to our listeners that we
I
haven't
know.
been regular with putting out episodes, but we're both enjoying summer and
Yes.
everything it brings. But we're so excited for today's episode.
Yeah,
It is something especially near and dear to Christina's heart. It's near and dear to mine, our company's, our overall mission. And so with that,
well, let me
today.
just say, welcome to the Unwrapped Podcast, everybody. We're so bad at this.
Okay, good.
um, I hear you have a fun fact for me, as always.
As always. Okay, so not directly related to wound care at all, but it is related to our conversation we're going to have today. So there are over 75,000 individuals experience homelessness in the Los Angeles County.
That's wild. But also not unbelievable because if you guys don't know, for listeners, I live in California. I'm around the LA area and even Orange County, everywhere. Homelessness is out of control, which I'm sure is in every city, right? Like especially with costs rising. It's like when you say that number out loud, it's crazy to me, but also like, yeah, that makes sense with what we're seeing.
Yeah, I mean, I guess it's especially like for you, it's like, okay, you can kind of maybe that number's a little bit more tangible for you. For our listeners, if you don't know, I'm in rural Utah. Okay. That number is 60 times higher than my town's population.
That's crazy.
60 times. And to me, it's like I couldn't even fathom that, right? Of course, when I come to visit you, and obviously I visit cities. Like I'm not just like out here in a little farming town by myself, never leave. And I used to live in Las Vegas, right? So like I hear that number and I'm like, okay. But then when I like drive down to my local post office because we don't have mailboxes because we're so rural, um, there's not even a fraction of that in this town, right? So day to day, what I see. So yeah, hearing that number, it blows my mind. And it really speaks to this conversation we're about to have with Hawkeye Brimbuela, who is part of our WCA team. Well, he'll introduce himself later, but yeah, Christina, give us a little glimpse of what we're going to be talking about today with Hawkeye.
Yeah, well, first off, bias, but Hawkeye is one of the most incredible humans that you'll ever meet. He comes off as this rugged guy and sometimes intimidating to talk to, but I've never met someone who has such a passion for this the field that he's in. He's been a nurse for a long time. We were fortunate enough to get him, gosh, I think almost a decade ago, where he was wanting to do more in wound care. He was brought on at our UCLA team and has just thrived there. And obviously it was just it was easy for him to grow within the company and be where he's at now, overseeing the Western region. And something that Hawkeye and I bonded over is our passion for wanting to help those in need. And when our client, UCLA, introduced us about the Homeless Healthcare Initiative, which for those of you who don't know, UCLA system started almost like a street care type of clinic, van based, where they drive out. They started off with 2 vans. You'll hear more about that from Hawkeye. And now I think they have like 5 vans, but they go out to different parts of LA and provide care, not just wound care, all care. And that could be from like maintaining their mental health meds, or they're sick and need antibiotics, or they don't have a ways or a means of getting any type of PCP care, whatever. It is a holistic approach that they do, and wound care that they were seeing an increase up. And that's why they reached out to us, because we already have a wound center with them. And so they were like, hey, can you guys just help? Like, these clinicians just need more education. And so that's really where it started, of just teaching wound care to then being like, can we do a ride along, to then really seeing what they're doing in the street, to then being like, oh, hey, we can give you guys more resources. We can get vendors engaged. We can build you wound packets. We can build you education. We can support you in A, B, and C. And it just kind of grew from there. And that's why I really love this episode. I know you guys, we say we love every episode we do, but I love this episode because you guys are going to really hear from the start to where we're at now. We're nowhere near finished, but like where the program from our perspective has grown from a wound care view of what we've been able to do. And just if this encourages you or encourages or pings something in your heart that really resonates with you, like that's what we want out of this episode, to just kind of share where it's grown and where it's going to go.
Yeah, absolutely. And I love that you say that. And as always, you're right. This isn't just about the clinicians. This is for everybody that's kind of in that public service industry, whether you're, EMT, fireman, policeman, teacher, anyone that's dealing with the public. I think this episode is so valuable to all of us because there's a place for every single one of us to help and do more for this patient population. Because, whether you're the teacher and you can see those in your students, whether you're the policeman and you're just trying to make sure they're safe on the streets, the firemen that are also being called out, EMTs, right? So it's really just there's a place for all of us if you want to do more. And hopefully, after you listen to this episode, you'll have that little spark burning a little brighter, and you'll kind of want to help out. So if you don't know where to start, Christina has already mentioned this, and she'll mention it again. Reach out to us. We'll help you find a place.
Yeah, absolutely. So with that, we'll bring on the interview. Anyway, thanks so much for joining us today, Hawkeye. We're thrilled to have you here.
Thank you. I'm excited to be here as well.
For those of you who don't know Hawkeye, this is Hawkeye. And yes, that is his real name. Hawkeye, I've had the privilege of working with you for many, many years now, but will you share with the audience your position, your background, how long you've been working with us?
Sure. Been in the healthcare field for quite some time now. I started as a CNA, did that for a few years, LVN, and then for a few years at Harbor UCLA, worked for Kaiser since I became an RN. Majority of my time was in the telemetry, and in the last few years of my career, I was a charge nurse in med surge telemetry and just doing different aspects and whatnot. I left Kaiser and I joined WCA in 2015, 14 maybe, 16, something like that. I don't know.
Coming up on 10 years.
Coming up on 10 years. And I started with WCA as a clinical nurse at our UCLA wound care center. After some time there, I became the clinical director there. Did that for about 2 years, and then I was fortunate enough to be asked to be a regional clinical coordinator, which I've been doing now for the past 5 years. Yeah, 5 years. So yeah, that's my job. I get to oversee a lot of our risk share centers on the West Coast, as well as a few other centers around this area, and been with WCA for a good time. For a good amount of time.
There's one thing you guys need to know about Hawkeye. He's a humble man. He runs our West Coast region. That is obviously because it's the closest to our corporate office. So these centers are more involved. This staff, he oversees not only operations with his operational counterpart, but the staffing. So a lot of day-to-day things. And yeah, we're just so thrilled to have you here. We are excited to talk about the Homeless Healthcare Initiative that you have helped start at UCLA. So for those who don't know, one of our clients is UCLA, and we've had a wound care center there for well over a decade. And we got involved with their Homeless Healthcare Initiative, I'd say like 3 years ago.
Yeah, it's been about 2 years since we've been talking about it for 3 years.
Yeah.
And then, in the last 2 years, really have, implemented it, done the training, gotten people involved. So big kudos to you guys for actually getting it off the ground.
Yeah, it was something I think Hawk and I both really had a passion to help the people that have been experiencing homelessness. And just because we know with drug use and all of that, especially in San Francisco, like when we talk about all of our clients in different areas, that wounds were a big issue. And a lot of times, especially UCLA being UCLA, we do see a lot of this population in our clinic. And so when we found out that our client was actually sending a team out, like a dedicated team, day in and day out, clinicians, physicians volunteering their time to do this service, we were really interested in it. And so, they had asked us, and obviously, kudos to you, Kallie, because you helped us build the education platform and everything that supports what Hawkeye and Brian does out on the field with the team. But the reason why we were so excited to talk about it is, you know, we've learned a lot these past 2 years, a lot of changes and adjustments because it was very different, right, Hawk? I think like you and I talked about how we had to change how we thought about things, very different, and in the outcome and what we wanted to happen as well was very different because of you're doing street care essentially. But yeah, I just kind of wanted to pick your brain, Hawkeye, of like kind of everything that you've had to do and experience with the team and the things that you've taught them. Like, how's it going? What's kind of been the hardships? What's the things that you've learned? Tell us all the stuff.
All right. Well, I guess I'll start from the beginning. So when I first learned about the homeless healthcare team, or the HHC, I guess is what they refer to it as, is I was just super curious on like the why, right? That's always important. Like, why are we doing this? How did this even come to be? And I guess 2016 was the initial kind of rollout where they started to identify needs. Initially it was just about going out to the street, helping with like housing, helping with mental health and behavioral issues. And then it started to progress. I think that a lot of Medicare beneficiaries were out there. And then they started creating different programs. I think the first one was the whole person care program. And then it morphed into, or then it turned into like a housing thing. COVID kind of like accelerated all this and how we can do better. And it wasn't till 2022 is when UCLA was the first homeless healthcare collaboration launch. And that's when they were kind of state funded. And essentially they started off with 2 vans and they were just going out and just trying to meet the need, right? Trying to provide, high quality healthcare, try to have like equity in the community and just kind of solve these problems. And when I was talking to some of the members of the team, they were saying, one thing they noticed too was that a lot of our ERs, specifically the UCLA ER, was inundated with just like a lot of individuals who were experiencing homelessness. They were going there for minor things, and it was impacting kind of the flow of the ER, right? How much of this stuff could we have, I think the question became, how much of this stuff can we address or help with outside of, the ER to kind of decompress the ER and allow for more emergent issues. And again, early 2022 is when UCLA created that program. They started off with 2 vans. And then it wasn't until 2023, they started having, they were seeing a lot more wound care patients. As you can imagine, given, the same types of disease processes, comorbidities, issues that individuals have, this homeless population also experiences that as well, right?